And so SEPP has brought, I think, two of the top guys in the country to help us think through these issues on a policy level. You're going to hear a bit later from Greg Scanlon from the Heartland Institute, who's going to talk about ways in which free people are working their way around an already dysfunctional system. And I think that's a cause for hope. But we're going to lead with Michael Tanner. Michael Tanner is well known to people who are interested in policy, economists, policy wonks like myself. Journalists are very familiar with his work. He works for the Cato Institute, which is probably the preeminent free market think tank in America. He's written extensively on all topics regarding government intervention in markets and government provision of social services. He has written what I think is a prophetic book called Leviathan on the Right, how big government conservatism brought down the Republican Revolution, and we see it coming down around our ears, and if they had listened to Michael Tanner, it would not be. He is especially an expert on matters concerning competition in the provision of health care and has done extensive work in that area. One of his more recent books is Health Competition, What's Holding Back Healthcare and How to Free It. Michael Tanner is one of the most prominent experts in the country on matters of health policy, and we're fortunate to have him here this evening, so I hope you'll welcome Michael Tanner from the Cato Institute.
Well, thank you very much. I certainly appreciate that warm and entirely deserved introduction. I have to say it is better. The other night, someone introduced me, said, now here's Mike Tanner, a man who needs no introduction, which is a good thing because I've never heard of him. So this is much better. I also have to thank SEPP for having me here and getting me out of Washington. Always welcome. I not only live, or not only work, but I live in Washington, D.C., so it's, I'm always thrilled to be somewhere else. Although I understand if I could have stayed another couple of days, there was a bailout waiting for me. So I was sorry about that. At any rate, I'm thrilled. I'm thrilled that SEPP's been able to put this together because I do think healthcare is going to be one of the keys issues in this upcoming election. I want to talk to you a little bit about it and talk about both candidates' plans. I have to tell you, I'm relentlessly nonpartisan. I'm extremely opinionated, as you will find out, but relentlessly nonpartisan. So I may have good and bad things to say about both plans as we go on through this. But at any rate, it should give you some information that you can talk about, and then hopefully, when the question and answer session, you can try and pin me down a little bit more on this. I think if we're going to go into this debate and talk about the healthcare system and what we need to do about it, we should start off with a simple fact that for all the problems, which I'm going to go into in a minute, the United States still has, I think, the world's finest healthcare system. Certainly in terms of innovation, the last 25 Nobel laureates in medicine, 18 either are U.S. citizens or do their research in the United States. Of all the pharmaceutical products introduced worldwide over the last 30 years, more than half are patented in the United States. And of non-pharmaceutical medical breakthroughs, things from transplants to MRIs and so on, 80% were introduced in the United States first. In terms of quality, we have the highest ceiling in terms of quality in the world. I mean, if you're sick, this is where you come. When Silvio Berlusconi, the former and now current Prime Minister of Italy, needed heart surgery, he didn't go to an Italian hospital. He didn't go to Canada. He didn't even go down to Cuba with Michael Moore. Instead, he went to the Cleveland Clinic in Ohio because that's where you can get the best care in the world. Tens of thousands of patients from around the world come to this country every year for treatment because they know this is where you get care. And if you just want to look in terms of outcomes for health care, you can find that in terms of almost any disease you want to pick, the outcomes are better in the United States. The British medical journal, The Lancet, just published a study showing 5-year survival rates for cancer. They combined all types of cancers, looked at the percentage surviving 5 years or more with those types of cancer. The United States was #1 for both men and women, and beat the next highest country by more than 5% of the population surviving at least 5 years. It was an enormous gap. Now, I know that opponents of the U.S. healthcare system, people want sort of national healthcare system, often point to life expectancy and say, well, the United States, the other countries live longer than we do, so therefore they must have better healthcare systems. But I would just point out that life expectancy is a terrible measure of a healthcare system because there's so many what's called exogenous factors, things outside the healthcare system that get involved in that. I mean, there's accidents and homicides and suicides and all these sorts of things, which we have much higher rates of than other countries. I mean, after all, think of it this way. If healthcare systems were the determinant of life expectancy, why does Utah have a 3-year longer longevity than Nevada? Essentially they have the same healthcare system. So I think you can kind of ignore that sort of thing and look at the outcomes of specific diseases. Cancer, we're number 1. Heart disease, number 1. AIDS, number 1. Pneumonia, we're number 1. I mean, you can pick your disease and you're much better off here. And choice. We have much, as much as it's been declining, we still have much more choice of healthcare plans, healthcare physicians. You can go get the type of treatment you want from the doctor you want generally. It's not always true. I just did a study of other countries around the world. You realize that in Spain, you get your doctor assigned to you based on your address. Where you live, there's a doctor assigned to that address, and that is the doctor you have to see. In this country, people move around to get the best school district. In Spain, there's actually a phenomenon of people moving so that they can see a different doctor down there. So you don't always get the choices that you have in this country. So I think we have some really good things. But we also have some significant problems. Cost is an issue. We have the most expensive healthcare system in the world, by far. We are about 1/3 more expensive than the next nearest country, Switzerland. And we're about double the average for industrialized countries worldwide. Now, I always add a little bit of caveat here. To a large extent, we are spending more on healthcare than any other country because we can. We all want to live forever, and we're a wealthy country. So we spend a lot of money on healthcare, doing things that a lot of other countries wouldn't necessarily do. Economists consider healthcare a normal good, is the phrase. And that means that as incomes rise, expenditures rise. As the richest nation in the world, we choose to spend a lot of our discretionary income on healthcare. Heck, we spend more on everything than any other country in the world. We spend more than double the next nearest country's expenditures on running shoes. And no one yet has come up to talk to me about the great running shoe crisis in the U.S. But the fact is, healthcare costs are rising at a significant rate. Then that is putting a strain on business budgets and government budgets and individual budgets. And because the way healthcare costs are distributed, some people are getting just all the healthcare they want, and other people can't necessarily afford all the healthcare they would like to have, and that's an issue that might have to be dealt with.